Hello, nursing students. This is Stephen-Castro, and this is going to be our presentation on viral hepatitis. Particularly, we're going to focus on hepatitis A, hepatitis B, and hepatitis C. Viral hepatitis is a systemic viral infection that causes some necrosis and inflammation in the liver or causes liver damage. It can be acute or chronic. There are 5 main types, A, B, C, D, and E. Again, our focus is primarily going to be on A, B, and C. I have a glossary here posted of some very common terms associated with hepatitis. It's also posted on your PowerPoint, and there is a list of terms that I have provided for you on your guided reading. When you complete your guided reading that I have listed in Blackboard, make sure you address one of the questions there. It's break it down by mode of transmission, the manner of onset, and the incubation period, because a lot of your teaching and education is going to revolve around prevention, and that's going to revolve around how it's transmitted. Hepatitis A, HAV, and hepatitis B, HBV, are on the decline due to vaccinations. There are vaccinations available for these 2 subsets of hepatitis. Hepatitis C, on the other hand, is the most common, and there is no vaccine for hepatitis C. So hepatitis A, it's a hardy little virus. There is a vaccine available again. It is transmitted through that fecal-oral route, which is why it's really important to wash the hands, especially after the bathroom. That's why you see all those signs in the bathroom. Bleach is also a very effective cleaner and disinfectant for HAV. Hepatitis B is transmitted through sexual contact and blood contact or body fluids. It can also be transmitted in childbirth from mother to baby. So your teaching will revolve around that. It also has a risk of the client becoming a chronic carrier with infection. HCV is transmitted via blood and body fluids, sexual contact, dirty needles, improperly disinfected needles, tattoos, those types of things. There is no vaccine available for HCV, and it also can become a chronic carrier condition. So you'd begin your assessment by asking for a history and see if they've had any type of exposure to hepatitis. And that's going to include knowing how the virus is transmitted, whether it's drug or alcohol-related or sexual activities, or potentially any travel to outside the country. Signs and symptoms may include right upper quadrant plane where that liver is, as well as lack of appetite. You may see darker colored urine, fever, nausea, vomiting, and muscle aches, flu-like symptoms as well. If it's severe, you may see that jaundice, and you may see elevations in those liver enzymes. Acute hepatitis typically has stages. The pre-icteric is where you're first exposed and starting half of the symptoms, and that is before the jaundice sets in. It's more like those flu-like symptoms, may have some GI distress. The icteric stage is where the jaundice and the itching and the dark urine start to occur, and the post-icteric stage is where everything hopefully starts to turn to normal. One of your priority problems for clients with hepatitis is going to be weight loss or anorexia, and that's usually due to the complications associated with that inflammation of the liver. Priority problem number 2 is fatigue. They generally have less metabolic energy protection because of the damage being done to the liver or the inflammation of the liver. So make sure to provide plenty opportunities for rest. The 3rd priority problem is potential for infection because of the immunocompromisation with hepatitis. With hepatitis A, primary transmission is going to be fecal-oral. It may be difficult to trace down to the specific infected person. It may take about 4 weeks before any symptoms appear, and manifestations include those flu-like symptoms and later that icteric or the jaundice and those associated symptoms. With hepatitis A, it can be found in the stool up to 2 weeks before symptoms, so they may be spreading it without realizing they have it. Again, you're going to contribute to poor hygiene because of the fecal-oral route. There is testing available. Treatment's going to be rest and healthy meals, and you may have post-exposure prophylaxis. Prevention of Hep A is going to revolve around breaking that mode of transmission. So good hand washing, safe water, proper sewage, and encouraging the vaccine where available. Possible immunoglobulin for those people who have been exposed. Encourage bed rest and good nutritional support. Hepatitis B, while globally is the most common form of hepatitis, it's not the most common here in the United States. Mode of transmission is through blood and body fluids, including sexual contact and needle sharing. It can live on surfaces up to 72 hours, and the incubation period can be up to 6 months. Although it doesn't happen frequently, hepatitis B patients may develop into chronic carriers, and that can lead to liver disease, cirrhosis, or even liver cancer. Again, it's the most common worldwide. It's the most common worldwide cause of cirrhosis. Management of hepatitis B infections may include alpha interferon or some antiviral agents. I am not going to put any medications on the book. I'm going to leave the medications for the pharmacology class, but we want to encourage bed rest, nutritional support, and prevention. Get the vaccine if possible. Hepatitis C is the most common form of hepatitis C here in the United States. Again, it's blood and body fluid transmission. High risk people include the baby boomers, that age group. It also has a lot more frequent acute versus chronic. The HCV infections are frequently asymptomatic or very mild within that first 6 months, and then they may remain asymptomatic they're out if they are chronic carriers, if they turn into chronic carriers. If they do have symptoms, they are similar to the other symptoms of hepatitis infection. Now, these stats I have are about a year old. Sometimes it takes a while to get the newest data out, but it may be have an incubation. Just some additional facts about hepatitis C. Again, it's the most common bloodborne infection here in the United States. It causes about 1/3 of the liver cancer cases and most common cause for a liver transplant in the United States. A few special things about hepatitis C is that they do quantitative testing to see how much of that viral load is in replication. And also because there are several genotypes of hepatitis C and they are very, very different. If someone is diagnosed with hepatitis C, they need to go through genotype testing so they can determine the treatment. There are a lot of new medications that keep coming out on the market to help treat hepatitis C because it is so prevalent in this country. I am not going to test specifically about any of these medications on the exam. I will leave that to pharmacology. But just realize that the medications can be costly, expensive, with a lot of complications. While hepatitis D won't be specifically on our test, I do want to just bring up a couple of things about it. Hepatitis D depends on the B envelope to transmit, so the best prevention for D is to get the B vaccine. It is also the most common that will lead to fulminant hepatitis. This is more common in more underdeveloped countries. Again, hepatitis E will not be on our exam, but you may see it somewhere else. But hepatitis E is, again, more common in underdeveloped countries. It also is the fecal-oral route, and it may take up to 60 days for symptoms to appear. Again, best defense is going to be good hand hygiene, boiling the water, such. Treatment for viral hepatitis is going to revolve around reducing transmission as well as addressing those priority problems. So reduce the risk for infection by encourage good hand washing and also prophylactic treatment, provide for rest, and encourage good nutrition. Most clients with acute hepatitis are managed at home. They don't typically have to end up in a hospital unless something severe is going on. The hospitalized cases are typically those with chronic conditions that lead to end-stage liver failure or cirrhosis. So just to reiterate, when you reflect on your client's needs, maintain that nutritional status for adequate body requirements, and report any increasing energy levels as the liver rests, and try to maintain an infection-free environment for your client. Here are a few other websites with a plethora of information regarding hepatitis if you choose to read a little bit more. Other forms of hepatitis include the non-viral hepatitis, which is toxic or drug-induced hepatitis, that fulminant hepatic failure, as well as NASH or the NAFLD. The NASH is the non-alcoholic steatohepatitis hepatitis or the non-alcoholic fatty liver disease. Here are some other websites that are full of hepatitis information. Again, please use these at your leisure. Here's a list of your references. If you have any questions, please don't hesitate to reach out. And as always, I encourage you to do the guided reading, read the information in your book. If you have any questions, reach out to me. Thanks.